you start on the hormone replacement, how long before you should have a repeat done in your saliva testing?
Okay, after you start on the hormone therapy, how long should you wait before you have another follow-up saliva test? I recommend a minimum of 60 days, just because of the promiscuity of the hormones. DHEA can be converted to estrogen, it can also be converted to testosterone, and you want everything to kind of settle down to see what's going to happen in this patient. So I don't retest any sooner than 60 days. Now, a lot of times the patients want me to test because they say, oh, I'm feeling great, I'm feeling so much better. Let's do a test and see how things look. Let's see if I'm balanced. But I wait at least 60 days. If everything's fine at 60 days, then I will check once a year. If it's not, we may have to check a time or two more. We might just have to look at part of the hormone profile, the part that we're focusing on, and where we're seeing some imbalance.
So obviously this testing is covered in the U.S.? It's not covered here?
No, she said it's testing covered in the U.S. Not necessarily. Some of patients' insurances do reimburse for saliva testing, but most of my patients, they're willing to pay because they want to know what's happening in their body. They want to know what's happening with them, and they want the most accurate way of investigating that. And so we work with them to find a way for them to be able to have that test. Medicare was paying for it, but then they stopped paying for it a few months ago. So that's the status there. Yes?
How do you get your doctor to test you? I've tried before, and thought it was crazy.
Yeah, how do you get your doctor to test you? I've tried before and thought it was crazy. I know that sometimes the medicine here may not be as consumer driven as it is in the United States. We have private practice there, and people are competing against each other. And when really the consumer is the patient, and they're the driver, and they have a choice. But I understand here you get assigned, and there's issues related to that. I would just encourage you to be as forthright as possible and say, even if you don't believe in this test, it's my body, it's my life, it's my choice, and I feel like that I need to have this test in order to help me make some decisions. You can get the test kits at pharmacies.
Yeah, but I don't have to get them to prescribe.
But a healthcare professional needs to give you permission. Yes. You can do home kits for blood type, for cholesterol, for blood sugar. This is no different.
For me just to satisfy me after I bought them.
Yes. Blood work, yeah, it's probably normal. It almost always is. The fervent prayer of a righteous man availeth much. You might just keep knocking on the door and keep pestering and asking, or get the nurse to get him to sign off. Finally, they'll just say, okay, Ultimately, you may have to change providers if you just feel like they're not communicating. To print out the position statement from the American Academy of Family Physicians and say, this really resonates with me, and this is what's going on in the States, and I want to be part of my health. And I don't know, maybe some other comments here.
That's just where it stands.
I think it's your choice, and you have to demand it. And I would keep demanding it. Yes?
My doctor, we didn't go for a saliva test. He did blood work, and he did give me a prescription for the bioidentical therapy. And I was on it for about 3 months, and it worked great at first, and then it just stopped working. What would you say to that?
Yeah, she said that she did have testing. She had serum testing, and then her doctor prescribed bioidentical hormones.
I didn't have the saliva test.
Yeah, not the saliva test. It seemed to work for a few months, and then it seemed to stop working. Well, I have no idea what dose you were on or what the combination was. I think each patient has to be treated individually, and of course stress factors, dietary lifestyle factors all impact the hormone milieu. Sometimes I see that there's a problem with the compound itself. My patients want to save money, and they go to the bottom dollar place, or they do a mail order. And I said, because I was just saying, where are you getting your compound? Oh, well, I changed and I mailed it into so-and-so. And we've done random testing with some of those, sending them to an analytical lab, looking for quality and potency, and they really fall short. And so it matters where you obtain the compound. Sometimes the base changes that the pharmacist is preparing it in, and even that base change can affect how well you absorb it. Now, were you on pills or were you on
No, cream.
the cream? Yeah, so sometimes the base is a factor. Sometimes there's an initial upregulation of estrogen receptors, and then there's a downregulation when you're giving progesterone. And so you have to make a change 3 to 4 months down the road based on, you know, like we talked about in 60 days, what's happening with the receptors. I didn't talk about all of my clinical studies, but I do think it's important as women go into their 60s, 70s, 80s and beyond that they be hormonally balanced as it relates to dementia risk and other quality of life factors. So I would say I wouldn't give up. If you truly are deficient in some area and need some support, I would be reassessed. I think it's extremely important. Yes, in blue.
Is a personal history of breast cancer, is that a problem with taking the hormone replacement?
Is a personal history of breast cancer a problem with taking the bioidenticals?
Yeah.
We have our patients sign a special consent if they have a history of breast cancer, just because our legal counsel is really hypersensitive about all of this. And the hormones, even the bioidentical hormones, may be carcinogens. Now, I think keeping the progesterone and estrogen ratio in balance is very important. I think DHEA is extremely important. Looking at glucose insulin is important as far as preventing recurrence. But I do have breast cancer survivors that I've assessed and have used the hormone restoration model of care. If you read Dr. Zava's book, What Your Doctor May Not Tell You About Breast Cancer and How Hormone Balance May Save Your Life, I know it's a big mouthful, but it's by Dr. David Zava. What Your Doctor May Not Tell You About Breast Cancer. I think that's a good resource that goes into breast cancer risk. And I have not had any patients, have recurrence, but I don't have thousands of breast cancer survivors on this regimen, so I can't attest to that. Dr. Rebecca Glaser, Glaser, has a large cohort of breast cancer survivors. She practices in Ohio, and she uses a lot of testosterone in breast cancer survivors, and she thinks keeping that testosterone up is really key as it relates to prevention. She's got a much larger caseload of breast cancer survivors than I have in my practice, and she's very comfortable with the bioidenticals as long as our goal is physiologic reference range and we're staying in balance.
It's how do you spell that again?
Glaser, Dr. Rebecca Glaser. Okay, lady in the stripes.
In the stripe. How do you know, in taking the whole bioidentical process thing, how do you know at what point you can stop? Or you're ready to stop? I don't want to stop and then find out, oh, you should have stopped.
In the whole bioidentical hormone process, how do you know when to stop? Well, when I look at the data, I'm not planning personally to stop because I want the cardioprotection, the neuroprotection, the anti-inflammatory benefits through hormones. I don't have to go take other drugs to get this type of benefit when I can do it in a natural way. Our study is it's called the MAD study. It's looking at mood, aging, dementia, and cognitive dysfunction in people 60 and older. We found that hormone imbalances correlated with cognitive impairment and with depressed mood and decreased quality of life. And so I think it's important for all the decades. Now, the oldest patient that I prescribed hormones for was 92. She was on her way to the senior dance. She came in in a beautiful red dress and red high heels and a red headband, and her legs looked like a 20-year-old. But it's her choice. Just like my academy says, it's her choice to weigh risk and benefits. Now, if we are going to use hormones, I'm going to use is the bioidentical hormones. But I think as long as you're monitoring and keeping in the physiological range, you're going to minimize risk. Not to say that it's not possible to have some risk down the road. We're not going to protect and prevent against everything, but so many inflammatory conditions in women, dementia, osteoarthritis, diabetes, hypertension, and we know that these are anti-inflammatory agents and affect those pathways. I think it makes sense to, I don't think there's a stop unless the patient says I want to stop for some reason. That's I can't give you a study on that, but it's something that. Yes?
Last year I had the saliva test done and I barely registered for progesterone and estrogen. So I went on to the bioidenticals and I felt miserable the whole year. And I just got retested. My progesterone came up 50%, but my estrogen only 10. And I don't know why it wouldn't come up more.
Okay, so she's saying that she had a situation where you had saliva testing, you started taking in estrogen and progesterone, pill or cream?
Cream.
Cream. And then you were retested a year later, and your progesterone came up some, but the estrogen didn't come up much. And then you didn't really have symptom relief.
No.
Okay. So did you check your DHEA and your testosterone and your cortisol?
Yes.
Okay, and all those were in line?
Amory. Were they in line?
So, okay, I think it's important, to look at the full profile. In those situations, I might look, we can measure all three estrogens. We can measure estrone, estriol, and estradiol. We usually just measure the estradiol. But sometimes I find that those patients, we need to look very particularly at the type of estrogen and the ratio of estrogen. Sometimes they'll feel better with a 50% estriol, 50% estradiol. So I wouldn't give up. If you really were low, if what you were doing on your own is not sufficient, then you want to find something that you can tolerate. And the right mix of the estrogen. Yes? If you've had a hysterectomy or more prone to heart disease, if they remove your ovaries, women that undergo ovarectomy have not only increased risk of cardiovascular disease, but increased risk of all causes of mortality. They don't live as long. They have more health problems over time. Now, there's a Scottish study where they looked at women with a premature menopause, and particularly at blood pressure and cardiovascular pathways having to do with the renin-angiotensin system. And they put them on two different regimens. One was birth control synthetic hormones. The other was the bioidentical hormones, vaginal and transdermal. And they found that the natural hormones, or they call them physiologic sex-specific hormone regimen, had a very favorable effect on the cardiovasculature. So I don't think it's inevitable. I think that you can protect against some of that increased risk through hormone balance and using the transdermal bioidentical hormones. But yes, women that have had ovaries removed are at increased risk of cardiovascular disease, connective tissue diseases, all-cause mortality in the epidemiological studies. And it used to be that the doctors always removed the ovaries when they did hysterectomies. That was common practice in the States. I don't know if it was here, but they did a lot of that. Now they tend to leave them more often because of this data that we know about.
We want to thank Dr. Kenna Stevenson for coming, and we hope you all enjoyed the